Hi everyone, welcome back to the Dr. Zia channel. In the video here today, we're going to be talking about what can you do today if you have a disorganized attachment. Let's get started. Alright, now this is a topic that so many of my viewers have asked for, which is what to do if you have a disorganized attachment. What can you start doing today right now? And look, I'm not going to waste your time. I'm just going to start rattling down a list of things that I find are useful and people who have a disorganized attachment have reported to me has been useful for them, and people who I work with, patients who I have shown me that that is useful for them by kind of attaining a secure attachment over the time, over a course of therapy, if you will. So here it is. I got a list here and I wrote it down. Let's go. So first of all, when you have a disorganized attachment, one of the things you need to think about is try to stay away from emotion triggers. Now, what I mean by that is you will know, we all know that there are certain situations, there are certain scenarios that trigger our strong emotions. Now, when you have a disorganized attachment, those emotions, or not all emotions, but sometimes emotions will be very difficult to regulate. So what you can start doing is right now, after you watch this video, you can sit down, write down 10 situations that tend to trigger strong emotional reactions from you and tend to trigger, because of those strong emotional reactions, behaviors that are harmful to others. But as you know, if you have a disorganized attachment, mostly to yourself, that's who gets hurt at the end of the day. It's mostly you. So start writing down 10 situations that are in your life at the moment and whether you can in one way or another change those situations. I mean, reduce the time you spend in those situations or avoid them altogether. Or, and I know that it's not kind of popular for psychologists to say avoid situations, but hey, when you have a disorganized attachment, there are some things that you're better off avoiding because those situations are harmful. Your mind won't let you see that, but they are. So avoid it. So stay away from emotion triggering situations. Yeah? Okay. Get informed is another one I have here. One of the things that happens with disorganized attachment is that a lot of the time when you're triggered, when you're stressed, when you're anxious, which if you have a disorganized attachment is a lot of the time, is that your limbic cortical system takes over. Now, in short, what that means is that your emotion center takes over in your brain. And that means that you can't think as clearly. But one way or one thing that you can do about that is try to strengthen your logical thinking, your information, your frontal lobe, the part of you that organizes you and kind of lets you think really clearly. Strengthen that up as much as you can by getting as much information as you can. Now you might go, well, what's information? Well, for example, you could be watching my YouTube clips on disorganized attachment and the other attachments and in general on attachment. You can watch my YouTube clips on therapy as well. There's a lot there for therapists, but there's a lot of kind of techniques that I'm talking about that you'll see might be useful for you, might apply for you. And you can also even comment here to me and let me know what you would like for me to talk about, something that's relevant in your life, and I can kind of make videos about that. Other things you can do is obviously read books. For example, one book here that I could recommend right off the cuff is Daniel Hill's Affect Regulation Theory. Fantastic book to learn about attachment in general, but also fantastic book to learn about disorganized attachment. So let's move on. Get connected. What I mean by that is there are so many local organizations wherever you are in the world right now. There are local organizations that help people who are in situations that similar as you are. So I don't mean that there's kind of organizations that help people with disorganized attachment, but there are organizations out there who are helping people with DV, domestic violence. There are organizations out there helping people with potential homelessness, with financial distress, with relationship distress, with difficulty finding work, with obviously mental health problems. So get connected, look around, ask people, search the web and see wherever you are in the world right now if there are any organizations that you can get connected with that can help you with things such as safety and security and wellness already today. Get out of unhealthy relationships, I wrote as well. I found that for people who have a disorganized attachment, the sooner they get out of unhealthy relationships, the better for them, because otherwise it kind of is that for my patients at least, they come here, they get a benefit, and then they go, and none of what we spoke about matters anymore, because now they're in an extremely hostile, violent, hurtful, harmful scenario again with their partner. And really, there's got to be a time where you kind of call it and you go, look, if the majority of your society says that this relationship is extremely unhealthy, if a large proportion of your society is saying that this is really unhealthy, and you know that you have a disorganized attachment, it might be a really good idea to get out of that relationship, because your brain is not going to tell you get out of that relationship. Your brain is going to say that harm is normal, violence is normal, it's not really abuse, look, it's not his fault, it's your fault, all those kind of things. And it's just a mess. Try if you can to get out of harmful relationships, or if at all, get out of relationships for a while. Just be you for a while and just get things under control and get things thought about, and then you can think about kind of going back to relationships. I know that's a harsh one, but look, it's just experience. Again, I'm just saying what people who come here have found useful and have reported to me is useful, okay? Get therapy. Of course, this should be number 1, 2, 3, 4, 5, and 10, but I didn't want to just kind of say the most obvious one. And for a lot of you people watching, I know I get comments from a lot of my viewers that they can't afford therapy. They don't have therapy where they live. They don't have psychologists where they live, for example. So I didn't want to just kind of throw that one off, but it's the most obvious one. It's the most helpful one. It's the one that's going to help you more than any of the other ones here on the list, even though the other ones on the list here are also helpful. Get therapy. And when you get therapy, if you can, if you have one around you somewhere, get an ISTDP therapist. It genuinely is, in my experience, the most helpful therapy for a disorganized attachment. And if you can't find an ISTDP therapist, I think other good therapies for disorganized attachment is cognitive therapy, a fantastic therapy to help a person with disorganized attachment, because it's very focused on the frontal lobe. It helps you think. Schema therapy being a deeper version, if you will, of cognitive therapy. And then we have dialectical behavior therapy, of course, DBT, which often is done, what it should be. The evidence for it is that it's done in groups, but it takes a lot of commitment. You know, the dialectical behavior therapy, oftentimes it's somewhere between 450 to 850 hours when it's evidence-based. So that means that, you know, there's a huge commitment there to therapy. But if you can afford that and you have that around and you can do that, you have the time to commit to that kind of therapy, then again, another really good therapy. So that's what I have for this video here today. I hope it was helpful. I hope it was useful. If you liked any of the tips that I gave here today, please, you know, I was about to say smash that like button. I don't know. I think a lot of people on YouTube say smash that like button. Please give this video a like and let me know what you think down in the comments below. Press that bell button. I'm losing my ability to talk here. I keep saying plus. So laugh. Plus that, plus. Oh my gosh. I'm out. I don't know what's going on with me here.